Hello, ladies and gentlemen. We're going to walk you through the stages of disc degeneration and how spinal decompression can help these. Now, this is the first one that we want you to see. You can see the vertebrae are here and here. The discs are here and here. And when we look at it more closely, we can see that the center of the disc, it's called the nucleus pulposus, that's healthy and thick. That helps cushioning. Now, we want this spine to move very, very well because the movement of these vertebrae actually pumps water into the disc to keep it healthy. But what happens is accidents and injuries and traumas in our past cause the mechanics to change in the joint. And that's when problems start, but it's not when you feel them. So we're going to move on to model number 2. So this one here is when the gel or the nucleus of the disc starts to get eaten away or degenerate. It kind of evaporates. It's not as jelly-like or as viscous as what we would want. So if these things move poorly, the center part goes away of the disc. And sometimes you can actually get nerve irritation and significant discomfort from this. But again, this is only the second stage out of 4. If this does not get corrected through either chiropractic care or more specifically spinal decompression, it tends to get worse as we age. Now, let's take a look at model number 3. This is the one where significant problems start to happen. So the nucleus, or the center part of the disc, starts rupturing and breaking through these outer rings. If you look closely, you can see that there's outer rings in the disc. When this nucleus pushes through those fibers, it gets incredibly painful because there's millions of nerve receptors and pain receptors on the outer part of the disc. That's what's called a disc bulge. And sometimes it can actually bulge out the back, so much so that it actually starts to irritate the spinal nerves where there are a lot of pain receptors. But also remember, those spinal nerves serve all of your organs, glands, and tissues. That's how your body runs. If this doesn't get corrected through spinal decompression, then we move on to what's called a sequestration or a significant herniation. Now you can see here, again, these outer rings are being disturbed by the center part poking through and rupturing through the outside. This is called a significant disc herniation. And if this part of the disc leaves it and provides like a secondary island type of thing, that's called a sequestration. Spinal decompression is the only thing that you can do short of surgery to fix these. Physiotherapy won't help, traction won't help. Spinal decompression is the go-to treatment for any kind of disc issues or spinal stenosis. We're very, very good at this. We're basically a Central Toronto and Toronto West referral center for spinal decompression. Come and see us. We can help you.